here before?
No.
Okay, so you need to fill out this form. Also, you have insurance?
Yeah, I have
Yeah.
it.
Oh, here you go. Okay, maybe you can have a
That's it?
seat. Maybe sister can help you filling out the form, and after you're done, you can let me know.
Are you a lot of? Can you follow me this way real quick? Alrighty, perfect.
Now go ahead and take your temp, okay? Open your mouth, close your mouth, please. Okay, now I'm gonna do your blood pressure. You can uncross your legs for me.
I threw up a little while ago.
You did?
There was some blood in it.
Okay, I'll be sure to let the doctor know.
Come in.
Hello.
Hi.
Hi, how are you? Good morning. My name's Luis. This is Raul, and we're going to be your nurses for today, okay?
Okay. Hi.
Can I have your full name, please?
Full name is Edith Lujan.
Edith Lujan. Okay, perfect. How you feeling today, Miss Edith?
I'm in a lot of pain right now.
Okay. And how are you related to the patient?
I'm her sister.
Sister. Okay, nice meeting you.
Okay, so we're going to do a quick assessment on you. He's just going to be asking you a couple of questions. I'm just going to be assessing your seizure. Is that okay? Alright, perfect.
Alright, and then I'm going to be asking you some questions to see how's everything starting here, okay? So when did everything started?
So I usually get a lot of pain up here, like right up here, between my belly button
Okay.
and here. And but last night I started throwing up some blood,
Throwing up
and
some blood?
it was also my poop.
It was also in your poop. Okay.
But I've had it for several weeks now.
Oh, so it's been for several weeks?
It's just the pain.
Okay. Has it been like continuous, intermittent? What kind of pain do you have?
It's always there. It's like
It's
a dull
always there?
burning.
Dull? Okay. He's gonna be doing some vital signs, okay?
Okay.
And then how severe are your symptoms?
Like a 10 or a 10.
10 out of 10?
Mhm.
What do you take for pain?
I think my sister
Yeah,
has on my
I have
you
also
brought the-
made.
oh, okay, perfect.
She takes this.
Okay, so she takes on all these pills, okay? What is this?
I don't know why she takes that.
I have a friend who brought them from Korea. She said it helps with stomach pain.
Oh, okay. So is this like a herbal?
I actually
Or-
don't even know.
No? Oh,
I
okay.
just take them.
And then you're taking also aspirin.
Yeah, she takes aspirin, ibuprofen, a lot of pain reliever.
Oh, okay. So are your symptoms like worse when you're hungry, or how do you feel when you get hungry?
No, I don't really eat too much anymore because of the pain. So I've just been drinking a lot of liquids.
You don't drink it? Are these liquids yours? What do you have
Yes. I have my coffee.
here? You have your coffee.
And some chocolate milk and some tea.
Okay. What kind of liquids here? So does anything seem to improve your symptoms?
Sometimes when I drink milk,
Milk.
yeah,
Milk
I like
helps.
to drink that to feel better, and then the aspirin.
And then what makes it like worse?
When I eat a lot of spicy food, because I love spicy foods.
Oh, you like spicy
Yeah.
foods too?
And it just makes me feel bloated though. I always feel bloated.
Okay. Do you take anything additional to these medications right here? I know you're taking aspirin, ibuprofen, but do you take anything else other than that?
No, I was kind of hoping you could help me out, find something else, like
Okay.
stronger maybe.
Maybe something stronger? Yeah, we're gonna just complete some questionnaire right now, and then we're gonna call the doctor to see. We're gonna have the doctor come and see you to see what's the best treatment options for you. Okay.
Okay, now I'm just going to assess the abdomen. Miss Edith, are you in any pain right now?
Yeah, it really hurts right here.
Okay, where is ready? Alrighty,
It's
perfect.
like around here.
From 0 to 10, 10 being the worst pain I've ever felt, and 0 being no pain. How much pain are you in right now?
No, it's a 10 for sure.
It's a 10 for sure? Alrighty, perfect. So now I'm just going to be looking at your stomach real quick. Okay. Alright, so I'm just going to be putting my stethoscope on your stomach. It's going to be just a bit cold, okay?
Okay.
Okay. Is that okay? Is that a 10?
Yes.
Alright, I'm just gonna be okay.
It doesn't hurt there. So
Alright, so we're gonna call the doctor right now, and then she's gonna come and take a look at you. How are you today? So we have a patient Lujan here in room 5 today. She came into through the ER with abdominal pain.
Okay.
The patient, she has no history of smoking. She does like to drink a lot of alcohol, and she does smoke. She said that she takes a lot of ibuprofen, and aspirin. She puked blood, and when she went to the restroom, there was blood in the seat.
Okay. Was that the first time she said that's ever happened?
She said that it happens
The
consistently.
puking blood? Oh wow. Okay. And so what do you guys suggest? Do you think they should do a GI, a biopsy?
Yeah, we could do that, or we can do just an endoscopy.
Endoscopy. Okay, let me go ahead and we'll go ahead and get an endoscopy done. Anything else that you guys?
I don't know if you want to
No.
do some lab work. Because
Okay.
she's been having bloody stools too.
Mhm.
Maybe a CBC. What do you think?
CBC. Yeah, we could do CBC.
Edith,
with endoscopy.
my name is Bianca. I'm the DNP here. We're gonna have to go ahead and do an upper endoscopy. So I'm just gonna explain the procedure to you and what you need to do before. So what we're gonna do is we're gonna pass a thin tube called an endoscope through your mouth to see the lining of the upper GI, of the upper part of your digestive system. And also the upper GI tract. So this is gonna enable us to diagnose and treat the symptoms that you're having for the pain. That might affect the esophagus, stomach, and the first part of the small intestine, which is called the duodenum. So the benefits are to see if you have the reflux, ulcers, cancer, inflammation. That way we can know what route to go ahead and get you going. So before the surgery, we're gonna need you to not eat or drink anything for 8 hours. You also, I know that you were take some
Am I
aspirin.
gonna be awake for this?
No, you're gonna be under general anesthesia.
Okay.
So that you won't be awake during any part of it. So just nothing to eat or drink for 8 days. I know that for 8 hours, and I know they were saying you do take aspirin, but we can't have you take anything for 7 days because it's gonna put you at risk for bleeding and more complications. So 5 days before, also no NSAIDs, which are the anti-inflammatories. And we need somebody to drive you home. So you'll be able to drive her home?
Yes.
So no driving or anything after the procedure. Do you have any questions?
No.
No.
This is.
And this is just to diagnose you. We gotta see what's going on because you can have, a number of things. This is gonna let us see inside and get you started on the right path to hopefully get some more answers.
Oh wow, you see that?
Hello, Miss Lujan. How are you?
Hi. A little better.
Alright, so we brought you medicine for today. Alright, let me just take a look. Can I have your name and date of birth, please?
Edith Lujan, 4375.
Alright, perfect. So today you're taking your antoprazole, and then also we have an antibiotic here for you, which is for the H. pylori that we already explained, but that one's also for your H. pylori. We have your Peptic, which is gonna reduce the stomach acid, and then we have the Cytotec, which is to protect the lining of your stomach. Okay, and then remember always with water.
Once you guys do get discharged, I know we mentioned before, and you did say that you did like to drink coffee, milk, and stuff like that. Once you go home, in order for the medications to work better and for us to prevent further damage on your stomach lining, we are going to need for you to stay away from coffee, milk, and I know a lot of people say that, oh, I thought milk was good, and it is, but right now in your case it has a lot of calcium, which could irritate your stomach. You also want to stay away from tea, and specifically you do want to stay away from NSAIDs, which those are basically kind of like pain medications, like aspirin. In case you do feel some pain, your prescriber did say for you to take Tylenol instead of aspirin, so you might want to take those instead. Okay. You also want to stay away from chocolate just for a while, just so your stomach lining gets better. Do you have any questions?
So what can I eat and drink?
Eat and drink. Preferably water, and try to stay on a diet that is pretty much fruits and vegetables, just because it's easier to digest and it's easier for your stomach to just get it in and out.
Okay.
Yeah, and then also those spicy foods. I know you like them a lot, but just try to cut on the spices there, because I mean you wanna feel better, get well soon, and eventually you can just add a little bit there, but always with you need to restrict that.
And I know you are pretty young, so you do want to go out, but try to be careful with the smoking and the alcohol consumption, at least for now, just so that we can take care of your stomach for now.
Okay.
A variety of medications can be used to treat peptic ulcers. Protein pump inhibitors, or PPIs, reduce the stomach acid by blocking the action of the parts of the cell that produce acid. Long-term use can increase the risk of osteoporosis. PPIs can be prescribed by a provider or purchased over the counter. Most common PPIs are omeprazole or Prilosec, pantoprazole or Protonix, and esomeprazole or Nexium. H2 receptor blockers reduce the amount of stomach acid released into your digestive tract. They decrease the pain and encourage healing. Most common types of H2 receptor blockers are ranitidine and famotidine or Pepcid. Antacids can provide symptom relief but do not heal ulcers. Antacids neutralize stomach acid and provide rapid pain relief. These should not be used as your sole line of treatment for peptic ulcers. Surgery is a last line of defense to treat peptic ulcers in the case of an ulcer that has not healed after 12 to 16 weeks on medication, or for perforated, hemorrhaging, or obstructive ulcers.
Peptic ulcers occur mainly in the gastroduodenal mucosa because this tissue cannot withstand the digestive action of gastric acid, which is also hydrochloric acid, and pepsin. The erosion is caused by the increased concentration or activity of acid pepsin, or by decreased resistance of the normally protective mucosal barrier. A damaged mucosa cannot secrete enough mucus to act as a barrier against normal digestive juices. Exposure of the mucosa to hydrochloric acid, pepsin, and other irritating agents such as NSAIDs like ibuprofen, the bacteria H. pylori, smoking, and alcohol all lead to inflammation, injury, and erosion of the mucosa.
Hello.
Hi.
Hi, Miss Ida. I'm your social worker right now. I'm just here to tell you that since you're being discharged, there's going to be the hospital is going to reach to you for a survey of stay to tell them how was the treatment in here, just to let us know. And if you have any problems with financial assistance, help with outside doctors, or paying your meds, you can call me. Like I'll help you arrange anything for it. Yeah.
That's
nice.
great. Thank you.
Well, you're welcome.
Thank you.
If you need me, call me.
Great.
Thank you.